What's going on, everyone? Happy Tuesday. Hopefully everyone is doing well, staying safe, healthy, and having a great day so far. If you had to take a COVID test, flu test, or a test for some other virus, I hope you have tested negative. If you did test positive for COVID, flu, or any of the viruses, I hope you have a full and speedy recovery with no long-term issues and no long COVID issues. It is time now for the Tuesday edition of the Virus Update for Tuesday, May 6th, 2025. If you're new to my channel, this is the channel that gives you daily updates on all those viruses that can make us sick. Let's face it, there's a lot of viruses out there. Things are constantly changing. There's always news, and you need to be informed of what's going on. Just subscribe down below if you want to stay informed. Give this a thumbs up if you liked the video. Hit that notification bell. Share this video with anyone you know, and leave your comments down below. Already, we kind of have a twisted Tuesday. Twisted because the last few days there weren't as many news stories. Today, surprise, there's a lot of things to talk about today. So let's get right into it, shall we? First off, starting off with the Boston Celtics. Kristaps Porzingis is dealing with an illness yet again. So let me unravel this story for you. So yesterday was a playoff game that they were doing, and during that playoff game, he did not return in the second half due to an illness. And what we are finding out now is that that illness is in relation to what he was dealing with back in March. And back in March, he was dealing with some upper respiratory virus of some sort. And because of that virus, he was out for an extended period of time, from February 26th to March 15th. And apparently, he is still dealing with symptoms of that virus. Now, I want to raise your attention to something. I did some research. This is not yet in the COVID positive archive of my website, datareport.info, but it turns out he may have had COVID back in the earlier days of the pandemic. We'll say 2022. He had to enter COVID protocol. So him and a bunch of other players he was with at the time for the Dallas Mavericks potentially had COVID. There was an outbreak ongoing, and he had to enter that protocol. Why am I bringing that up? There's potential that his immune system could be impacted by COVID. He could even have long COVID. Don't know, just speculating here, but we've seen him sick oh so many times. Moving on to this now. South Korea reports 52 measles cases, highest tally in 6 years. So South Korea, no stranger to measles as well. We're watching measles rise all around the world. We have several measles stories to tell you about today. North Dakota reports first measles case since 2011, but turns out they're saying first case there. But then I found this story. That other one was from CIDRAP. This one now says 4 measles cases confirmed in North Dakota and 2 measles cases now confirmed in Minnesota. So, yes, measles an issue in those states. Measles is also an issue in Missouri. Remember yesterday, St. Louis, there was an exposure at St. Louis Aquarium. Well, today, it sounds like Missouri Department of Health is confirming yet another case of measles in Missouri. So, yes, things just continue to unravel for measles. Texas updated their measles count today. And at this time, there are 702 cases of measles that have been confirmed in Texas. This is an increase of 19 since the May 2nd update. 1% or fewer than 10 of the confirmed cases are estimated to be actively infectious since their rash onset date was less than a week ago. And let's go through some counties. Dawson, 26 cases. Ector, 11 cases. El Paso, 44 cases. Gaines is now over 400 cases. 403 total in Gaines County. Hockley County has 6 cases. Lamar, 18 cases. Lubbock, 51 cases. Up to 60 cases now in Terry County. And yeah, you get the idea here. There's a lot of cases. The majority of them are unvaccinated or unknown stats. That's 672 cases. 13 have had 1 dose of vaccine, and 17 have had 2+ doses of vaccine. And in the age group, 0 to 4 years old, 207 cases. 5 to 17 years old, 255 cases. 18+ years old, 219 cases. And 21 are still in pending status, whatever that's supposed to mean. Now moving up to, I believe this is Ontario. There we go. And in Ontario, we see that there are currently 140 new cases of measles being reported this week. The total there is getting really significant. 1,383 total cases there this year. Still higher than the U.S., but hey, we know here in the U.S., I'm very confident that we are missing a lot of cases. But again, 1,383 total cases now in Ontario. Yeah, that's not something you should be proud of, Ontario. It's not a good thing. I still think at some point the U.S. may pass. I don't know. That's a pretty big 1 week increase in Ontario. All right, this is something that is rather concerning. This has to do with measles as well. I'm not going to get to the political aspect of this. I don't know what I'm going to get into with this, but the point is, poison centers see a jump in kids with vitamin A cases during measles outbreak, and I believe it was RFK who said something about suggested vitamin A, whatever the case may be. It sounds like there is becoming a concern with parents giving too much vitamin A to their kids, and now they're calling the poison control centers. Yeah, this is not good, but the experts do say that children hospitalized with measles may receive vitamin A in an attempt to reduce the risk of serious complications. However, parents across the country have been calling poison centers with more regularly since the start of the measles outbreak. At times, vitamin A may be used in the management of patients hospitalized for measles to reduce the risk of serious complications. And since taking too much vitamin A can make you sick, this supplement should only be used under the direct care and supervision of a medical provider. Yeah, treating a patient with illness. Yeah, please do not just take it upon yourself. Get medical advice first, please. All right, moving on now to this. This is something rather interesting. COVID incubation period. Key facts and guidelines. So the COVID incubation period, in other words, the time from exposure to infection, it's changed a lot over the years. I mean, we've had original Alpha variant, which was 5 days, Beta variant, 4.5 days, Delta variant, 4 days, and the Omicron variant is down to 3 days. And remember, all these subvariants we are seeing right now are subvariants of the Omicron variant, the majority of them. Someone correct me if I'm wrong down below. I believe that BA 2.86, that may have had something to do with Delta. There may have been a relation somewhere. I don't recall. I'm not an expert when it comes to sequencing all these different variants. There are far more skilled people. There are people with degrees out there that actually study that and know the family trees of these viruses. I mean, let's face it, there are probably hundreds, if not thousands, of different subvariants and variants at this point out there that keep branching off. Some that never make it to the top, but individually, randomly infect a person and can be pretty serious. But the point here is, a general rule of thumb, 3 days, but I would, you know what, I would, if you're exposed, I would even test up to 7 days out, because you never know. It could take a while sometimes. I've seen cases where that has happened with people. I've seen stories where that has happened. All right, taking a look at the COVID update in New Zealand. Average new cases 45. The rats uploaded average is 110. And looks like they have 30 cases in the hospital. ICU number not given. Deaths attributed to COVID 1. And their total deaths 4,643. But then we come down here, we do see deceased number saying 7. I don't know why there are two different numbers. I'll never understand that. Taking a look at this. In Miami, this is not a good thing, and this is updated. This is as of May 3rd. We missed this, and this has to do with tuberculosis. Miami Federal Detention Center confirms case of tuberculosis, officials say. Why did we not see this the other day? I don't even know. Days after a case was found at Broward High School, the Federal Detention Center in Miami has confirmed its own single case, authorities said. Yeah, this is not good whatsoever. This was confirmed back on Friday of last week. Like I said, we just saw this story today. And St. Michael's Church, which is in San Diego, California, is warning of the potential for exposure to TB, as yes, there could very well be a tuberculosis case out there as well. Alrighty, moving on. That's a lot of news today, isn't it? Moving on to this from Canada. Viral activity levels have updated. COVID-19, flu A, flu B, and RSV, all moderate across the board today. All right, let's see how much bird migration traffic there is today, shall we? And while we wait for this to load, let's pause and take that hydration break. I forgot to do it yesterday, and I always constantly tell you, and someone did, let me know. Yell at me down below if I forget to do the hydration break. Someone did yesterday. Thank you for that. We're not forgetting it today. Alrighty, water was the drink of choice today. Great way to stay hydrated. Taking a look here at the number of birds in migration, and I got a feeling it's going to be a high number today. Let's see. Here it goes. Wow, already over 100 million, 200 million, 300, 400 million. Almost 500 million birds migrate. Matter of fact, it did go over 500 million birds today. You can see really high migration traffic in the plains, portions of the Midwest, portions of the Southeast, and the West Coast as well. Birds migrating to the north. Very fascinating, but remember, migrating birds could potentially carry H5N1, bird flu, avian influenza. Nothing really to show you on the website. I'll update a few things maybe tonight. Taking a look at what is going on with air qualities in the U.S., and I need to zoom this out when I refresh because it loads faster for the nationwide level when I do that. And here we go. Is it not too bad? A little bit of concerns in New Jersey and Connecticut, some around the lower portions of the Great Lakes like Illinois, Indiana, Ohio, also Texas, maybe portions of Georgia and southern Georgia and Florida, and the West Coast as well. And speaking of Texas, look at this. Really bad near San Antonio. I gotta look and see what's going on there. Something is definitely going on. Mexico as well, right there at that Mexico border. Problems there, too. Let's take a look at what is going on when it comes to, and I need to refresh this. Maybe that was up to date. I don't know. It still said May 5th. This is for heat-related illness calls now. If it ever comes up, we're going to see it's generally still minimal in the majority of the country. Yeah, just a moderate area down there in southern Texas. That could be a combination of heat and some of that air quality business. Minimal, minor on the West Coast as well. Minor in the northern plains. And we'll watch this map potentially fill in at the end of the month. And of course, June and July, as you know, there'll be probably all of these colors will be showing up in various different locations. All right, don't need to look at CDC measles. That will update on Friday. Taking a look at Pinellas County, Florida. Hey, we did a YouTube short on this last night. COVID and wastewater is starting to rise in portions of this area. And take a look here. Sick person calls. They're still high again today. 1, 2, 3, 4, 5, 6 of them right now. Yeah, there's just a lot of sick person calls there lately. I don't know if it's COVID related. That could also be their miscellaneous category. Sometimes they'll say illness or sick person. Could be someone with cancer. Could be someone with this or that. Could be someone who is sick with a fever. You know, could be anything. But the fact we're seeing it timed up the same as when COVID is rising in parts of that area, yeah, that's relatively concerning. Also relatively concerning, Philadelphia, yet again yesterday. 819 EMS incidents. More days than not lately are over 800, and we have not even gotten into the peak of heat-related illness season here, which that is oh so concerning. Taking a live look in at Montgomery County, Pennsylvania, we do see respiratory emergencies are a problem. 1, 2, 3, 4 of them right now, and a few other things going on as well. Taking a look at what's going on in Chester County, Pennsylvania, and we do see a sick person call and a few respiratory emergencies there. Also see a stroke showing up as well. Taking a look at what's going on with the hospital situation in Pennsylvania and southeast Pennsylvania. It's just very busy. It's going to probably continue to be like this straight on through to the summer. Lankenau, not sure why it's coming up green when I click on it, but yet when you look at it, it's showing up yellow. So we'll have to see what's here on the left. Mainline, Lankenau, they're having a behavioral health issue. Geisinger, St. Luke's, emergency department is overcrowding. Wellspan, New York is having a behavioral health issue. Wow, a lot of behavioral health issues today. Lehigh Valley Hospital, Hecktown Oaks, St. Luke's, Upper Bucks is having an emergency department. Penn, Chester County, emergency department issue. Mercy Fitzgerald is having an emergency department issue. And Mainline Health Riddle is having an emergency department issue. I don't need to remind you what's going on, but I will anyhow. You get just to the south and west of Philadelphia, 2 hospitals have closed. There was already a shortage of hospitals. Look here. Do you see any pegs here? These little markers here for hospitals like Kennett Square, out here south of Lancaster, southwest of Coatesville? You don't. A lot of hospitals have closed out in those areas. It is a real major problem, and it's just overwhelming the hospitals that are open. All right, moving on to Pennsylvania's update for today. Influenza A levels. Yeah, they're down, but they're still higher than the baseline of last year. This is for wastewater. RSV, yeah, that's still higher than last year's baseline. COVID is listed at very low. It is dropping at this time, but there's a few wastewater sites here that are still coming in at high levels in Pennsylvania. We're seeing up here in Bradford, Pennsylvania, yeah, your COVID levels, yeah, they're starting to rise a little bit. Monroe County, Pennsylvania, you've been going up a little bit. Now, you can't see this full chart here because it's blocking. I'm blocking the view my camera's blocking. But, yeah, trust me here, there are a few concerning areas, and we're going to have to keep an eye on this. Have not gotten an update from Northwest Montgomery County in a while, but this wastewater site here is listed in the high category at this time. Take a look at that. As of Saturday, April 19th. I hope that's has finally come down a little bit, but we'll just have to wait and see. Take a look at this now. And I do need to refresh this. I don't know if this is up to date or not. Okay, I guess it is. Influenza in Pennsylvania. We are now near 1,000 influenza deaths on a season. That's a pretty bad season for influenza. 231,584 laboratory-confirmed influenza cases have been reported season to date. Yeah, that's not good. RSV. 47,169 laboratory-confirmed RSV cases. I do know some people who have had RSV in Pennsylvania. One in particular, he had it pretty bad. Thank God he's still alive. But, yeah, it was really bad season for the viruses overall. COVID wasn't as bad in the wintertime, but guess what? And someone's going to type down below, oh, you're full of it, data report. Oh, come on, bunk. It'll be something that gets into the unapproved section, if you know what, of the comments, if you know what I mean. Probably get censored by YouTube, out of my control. But we're going to have a bad summer wave. We probably will. I mean, that's been the theme as of lately. Summertime does get a COVID wave. So we'll have to keep our eyes on that right now for this season. And I don't even, they should just show the entire year, but they don't. 1,126 COVID deaths for this, quote, season. Right now, the levels are low in Pennsylvania, or at least according to the report. Taking a look at what's going on in New Jersey, and we do see Cooper Hospital is on a total divert for patient volume. We also see a psychiatric issue at Penn Princeton Medical Center, and university hospitals having that as well. That's a pretty common issue, but to see a hospital full and total divert, that's problematic as well. But it does happen from time to time. We're just not seeing it happen at the levels that we saw back in the wintertime. New York State added 344 new cases today. And in the hospitals, take a look at this. Not doing too bad, New York State Hospital. In fact, it even went down today. 584 people hospitalized, 54 people in the ICU. Taking a look at what's going on this week at Walgreens when it comes to flu, and the national positivity rate is 1.49%. Almost 0.5% higher than this time last year. There is also less testing than this time last year. But if you take a look here, there are still a few states that have problems. 3.85% in Kansas. Wisconsin still 4.41%. Virginia is still 4.24%. Florida's at 1%. New York State 1.77%. Colorado is still 3%. Mind you, this is just testing from Walgreens. This is different than what you'll see from the CDC dashboard. Utah, 3.13%. And let's go to somewhere that's doing well. Well, that doesn't count because they're not reporting. Let's see here. California is not doing terrible. 0.34%. That's actually pretty good. And taking a look at COVID, the national COVID positivity rate at Walgreens data is 14.5%. When we take a look at Tennessee, it's 19.2%. It went up there, but your testing did go down. Missouri is 6.7%. That's up by 4.3% with testing up as well, 45 versus 42. North Carolina is at 11.2%. Georgia is at 9.6%. New York State is 24.8%. New Mexico is 10.5%. Arizona, 22.6%. California, 15.2%. And Washington, 13.2%. 0.3% at this time. All right, let's take a look at some wastewater sites. And I want to take you up to Alaska. We showed this, I believe, on Sunday. I got to show it to you again. Take a look here what's going on with COVID in Alaska. Yeah, listed high, and it continues to rise at this time. This is getting concerning. I mean, you are really rapidly rising. I hope there will be some sort of a correction here late week. Sometimes Wastewater Scan does a major correction later in the week. Let's hope we see that. We're going to revisit this later in the week, or when I see an update that looks like a correction of some sort. Hopefully it doesn't correct higher. We think it will correct lower. I do anyhow, but who knows? Let's take a look somewhere else in the United States. How about we come here to Wichita Falls, Texas? Haven't looked at that in a while. And we are seeing a slight rise at this wastewater site for COVID. RSV is low at this time. Influenza A is low. Influenza B is low. HMPV is low, up a little bit. EVD68 is low. Norovirus, up a little bit. And everything else seems to be fine at this time. Taking a look at what is going on, let's go somewhere else. How about we come down to Tallahassee, Florida? Is that rising? No, Tallahassee, Florida is dropping for COVID. Low for that, low for RSV, Influenza A, Influenza B, HMPV, low, all low. Norovirus is still listed at high, and to be honest with you, that needs to come down. That's still too high at this time. Let's go somewhere up in the north now. And I wanted to show you this. I think we may have missed this. Or at least when it came out, we did. Take a look what happened in Montpelier, Vermont through April. Really high levels of COVID there. Yeah, is that somewhat concerning? But then look what happened. As fast as it went up, it went right back down. So you may have somewhat of a sense of immunity there from that little quick burst of COVID you had that went back down. Yeah, that's relatively concerning that it went that high, just out of nowhere. Are you someone from Vermont? Do you know someone from Vermont? And do you know someone who had COVID there? Yeah, if you do, let me know down below. High chance you probably don't. But let's just randomly look somewhere else now before we end today. Let's do another check-in on what's going on in California. How about we go to San Jose, California, and we can see there, 1.5 million population here. You know, we should be looking at this wastewater site more often. Low for COVID, medium for RSV, Influenza A is medium, Influenza B, HMPV, EVD68, all high at this time. Norovirus is low, and some detections of hepatitis, no detections of Mpox at this time. Alrighty, folks, that does it for the Tuesday edition of the Virus Update. We'll have another update again tomorrow. If you enjoyed this update, give it a thumbs up. Subscribe down below. Help me reach 10,000 subscribers. Hit that notification bell. Share this video with anyone you know. And leave your comments down below. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Tuesday afternoon. Thanks for watching.